A 33-year-old man from Ecuador moves to the United States. He seems like a pretty healthy guy as he doesn't have any past medical history, never had any surgery, doesn't drink, doesn't smoke. But then he starts noticing that he's feeling tired more often. No big deal, he thinks, but his fatigue gets worse and he starts getting lightheaded, along with having headaches. And he doesn't have the same appetite like he used to. After 8 months of these symptoms, he decides it's time to see a doctor. Blood work shows that he is severely anemic. His hemoglobin is 3.1. Normally, it should be between 13 to 17 for a male. Why is his hemoglobin so low? He says he's never had any issues with bleeding before. At this point, his doctor appropriately decides he needs a blood transfusion and an urgent workup for his symptomatic anemia, so he sends him to the hospital. After he's transfused 3 units of blood, his hemoglobin comes back to normal, but doctors are asking questions like,
"Any cancer that runs in the family?"
He says no. Blood tests reveal the cause of the anemia. Turns out it's iron deficiency anemia, which almost always occurs as a result of bleeding. But he denies having any bleeding. He says he hasn't had any blood in his stools. So what's causing the iron deficiency anemia? The doctors, they're suspicious that the answer lies within the GI tract. So he ends up getting a CAT scan of his abdomen, and lo and behold, they find a 9-centimeter circumferential wall thickening of the proximal ascending colon. Not just that, they also see on the CAT scan enlarged lymph nodes in the abdomen. The diagnosis is all but certain. It's colon cancer, but more information is needed. A CAT scan of the chest is done to see if there's any metastases. There are none. CAT scan triple phase of the liver shows no metastases there either. Carcinoembryonic antigen, meaning CEA levels are checked, which is commonly elevated in colon cancer. That level was 6.1. Normally it should be less than 2.5. The patient receives a colonoscopy, and there they find a 30-millimeter ulcerated circumferential mass extending from the ileocecal valve to the hepatic flexure. There were also 2 other polyps found, 20 millimeters each, and they were removed during the colonoscopy. Histopathology of the large mass showed invasive, poorly differentiated adenocarcinoma, and the other 2 polyps turned out to be tubulovillous adenoma, with the other one being tubular adenoma. So he undergoes surgery to remove the right side of his colon and was started on chemotherapy. His CEA levels, they ended up being normal after 6 months after his chemotherapy, and a follow-up CAT scan showed no metastases. So the question is, why does a young, otherwise healthy person get colon cancer? Colorectal cancer that is diagnosed in patients under the age of 50 is defined as young onset colorectal cancer. There's been a huge rise in the incidence and mortality of young onset CRC over the past 4 decades. Now, to give you some numbers, about 1 out of every 5 patients diagnosed with CRC are below the age of 55, and it's a leading cause of death in the age group of 20 to 49. In the US, the annual incidence of young onset CRC has increased by 5% over the past 2 decades. And because colon cancer is not screened for in young people, and because it's one of the last diagnoses that comes to mind in a young, otherwise healthy patient, the diagnosis is usually delayed and the cancer is typically far advanced by the time it's recognized. The American Cancer Society and the U.S. Preventative Services Task Force recently modified the guidelines for screening colonoscopies to include ages 45 to 49. The increase in young onset CRC, it's attributed to behavioral, lifestyle, and environmental factors that influence disease risk. So smoking cigarettes, heavy alcohol consumption are associated with an increased risk, along with insulin resistance, which really goes hand in hand with eating highly processed foods. So obesity, type 2 diabetes, insulin resistance, eating highly processed foods, these things are highly correlated with colon cancer. Highly processed foods, they're devoid of fiber, they have added sugar, they're refined carbohydrates, there are other things that are added that you don't want in there. A lot of highly processed foods contains known or suspected carcinogens. So it's probably not a coincidence why we're seeing higher numbers in younger people. But the strongest known risk factor is actually a family history of colon cancer. In fact, 1 out of every 3 patients with a young onset CRC have had a family member with colorectal cancer. CRC is usually without symptoms, at least in the beginning, but sometimes there are warning signs. Red flags include rectal bleeding or blood in the stools, or unexplained anemia. Other warning signs include a change in bowel habits, belly pain, and weight loss. For more on warning signs of colon cancer, you can check out this video right here. It's important to be vigilant of CRC symptoms, even in young people, especially when they have risk factors.